Hello and welcome to another live broadcast with MedStar Health. My name is Sarah Ridenauer, and today I'm joined by Tara Saggar, internal medicine physician at MedStar Health Primary Care at Clinton and assistant vice president at MedStar Health. We are excited to talk with Dr. Saggar about ways to access primary care and urgent care at MedStar Health. Having a primary care provider plays an important role in achieving and sustaining good health. MedStar Health is making it easier to access care when and where you need it. Today, we'll talk about care options and how to best schedule your next appointment. So, welcome, Dr. Saggar. Thank you for joining us today. Um, Before we get into our questions, can you share with us a little bit about your background?
Yeah, absolutely. I'm Tara Saggar. I'm an internal medicine physician, which means I see adult patients in primary care, so ages 18 and above. I started in the Washington, Maryland, and Virginia area back in 2008 and have been seeing patients in this area since then, and specifically in Clinton, Maryland, which is right outside of DC, since about 2014 when I joined MedStar Health. And since then, able to work with the fabulous community here in Southern Maryland, and also have had the opportunity to have a leadership role within MedStar Health and work with our very talented primary care and urgent care groups.
Great. Well, thank you again for joining us and taking time out of your day to answer our questions. So let's get into it. We'll start with primary care.
Mhm.
People should have a primary care provider to help establish a baseline of care, diagnose, treat, and manage chronic conditions such as asthma, diabetes, and hypertension, track health changes over time, and make referrals to specialists when needed. But we know it can take time, sometimes several months to schedule appointments. So, specifically when it comes to scheduling an in-person primary care appointment or visiting one of our urgent care centers, what makes MedStar Health a better choice for patients?
Mhm. It's a great question. And I think my short answer on that is we just have a lot of great options. We know that this is challenging. We know that the whole world wants more primary care and urgent care providers. And so what we've tried to do is really offer options across the board. So when we talk about primary care, we really want that to be ideally a face-to-face visit with the patient, really get to know you, build that relationship. While we want to provide guidance, we also want to know what's important to you as the patient. And we want to have a trusted relationship. So we think that that's really, really critical. And we really focus on that for primary care. Now, once we've established that face-to-face visit, then the options really open up. Then being able to do video visits with either your own personal clinician that you're used to seeing or a really extraordinary member of our team who works side by side with your clinicians. And so video, in person, all of these become options to you. And they're also convenient options. There's times where you may not be able to come into the office, but you want to see your primary care. So video's given us even more ability to see our patients when and where they need it.
Yeah, that's great. That's great to hear. And what makes an urgent care visit different at MedStar Health?
So urgent care, we have yet another extraordinary team of individuals and such a large geography of locations. So we have 30 urgent care locations across the Maryland, DC, and Virginia area. And what that allows us is for immediate in-person visits that can happen all week long, um, even weekends, with even extended hours. In addition to that, not only is there such an opportunity to see people across 30 urgent care centers at even after hours and weekends, but there's also the ability to see a specialist in some instances and consult with a specialist even within that urgent care time. So it really helps with the connectivity, which is sometimes what we need to get really complete care for our patients. So that's a real big difference with our urgent care team. In addition to that, we also offer a virtual option, believe it or not, for our urgent care team. So this is 24 hours a day, 7 days a week, 365 days a year. It doesn't get any better than that.
Yeah.
And so to be able to really interact and correspond and get your needs met any time of the day, virtually, no appointment needed, is really extraordinary. And then this team is also looped in, our primary care and urgent care teams are looped in with this whole network of specialists. So we're better able to coordinate you with the care that you need, looped in with our large network of MedStar Health specialists.
Yeah, that's awesome to hear. Yeah, like you were saying, virtual is definitely a game changer. I know I've used it a couple of times and it's really helpful because you know, you can do it from wherever, you can be
Mm-hmm.
at home and it just makes things a lot easier.
Mm-hmm.
So yeah, if you'd like to learn more, you can see we have the link on the screen, medstarhealth.org/urgent care. And my next question for you is why is access to your primary care provider so important?
So we like to think we are the quarterbacks for the team that is the patient, the clinician, and their family. And so we feel like we're advocates, we're your support. It is so important that we are in great communication to maintain your health. Make sure that we have built a really strong relationship with you and really understand, like I was saying before, not just what we find to be important for you in maintaining your health, but also to know what's important to you to maintain your health. Knowing about your history, your personal experiences, your family history, all of that is really just our ability to be proactive in providing you good preventive health care and future care. And so getting access to us and interacting with us is so important. Now, again, the in-person, again, the video, but most importantly, you have a team here at MedStar Health that is working with you to care for you.
Yeah. And then I think you touched on this earlier, but what are the multiple ways primary care addresses your healthcare needs?
Mm-hmm. So first is how do you get in touch with us, right? So we can just pick up the phone and call that practice, and you will get a live person who will be able to coordinate that appointment for you and get you an appointment with somebody who is near to your home, who is convenient for your time and location. Another way is we have online forms that you can complete, and the message will come to us internally, and then we'll reach out to you to help you get scheduled. And a third way is simply to go online and schedule it yourself. So all three options are there for you. We try to make it as easy and seamless as possible to get the best patient care to you closest to your home. Um, and so that's one way that we're able to address your needs by contacting us. Another way is, as I mentioned before, our network. So we've talked a lot about urgent care, we've talked about primary care, we've talked about the video capabilities in both of those areas. But I must mention our fantastic, extraordinary specialists that we have. Great group of surgeons and subspecialists and providers across the organization that we communicate with on a regular basis, so that everybody stays informed on your care. And this is key because oftentimes we find in the healthcare system that there can be fragments of information. So one party may have information that the other one may not. And we take great pride with our organization in making sure that we have that interconnectivity, whether it's communicating verbally to the care teams or it is interconnected within our EMR, our electronic health record.
Mhm.
All of these are a way of really pulling everybody together.
Yeah.
And I would add yet an additional way for primary care that we're able to address your healthcare needs. Um, we know that we are in high demand and we're privileged to be able to serve our community. And so we have built virtual health teams around the primary care clinicians. So as patients call and they say, I really want to talk to my doctor or my nurse practitioner, and perhaps it's not available at exactly the time that is convenient for them, we are able to offer one of our teammates as a virtual option when appropriate for virtual to be able to satisfy their needs, meet their concerns, and address them. And they're linked in with our primaries. They're known to our primaries. We work regularly with them. So it really helps bring everything together. And it goes back to that team mentality.
Yeah. And you just mentioned, virtual appointments when appropriate. I want to get into that in a second, but before I want to go back to eVisit,
Mhm.
because I did forget to bring up the eVisit slide. Um, so can you talk a little bit more about eVisit? Go into, what it is, how you can use it, all the good stuff.
Yeah, absolutely. So eVisit is a video urgent care visit. And this is available 24 hours a day, 7 days a week, 365 days a year. So it is always available to you to address any urgent care needs. And things seem to, always happen on a Friday at 7 p.m. or, on that Saturday morning of a holiday weekend. And
Mhm.
we think, what are we going to do? Well, we have this great group of urgent care clinicians that are available to speak with you. You don't have to make an appointment. You can log right in using this QR code, and you will be set up to have that virtual appointment. And then from there, it could be that everything you need was addressed with that video visit. It could be that you need to be seen in person, but you have that person on the other side of this video who's able to direct you and give you that, that comfort, that confidence to know that maybe you could, wait until Monday, or maybe you do need to be seen in urgent care. And so this team is ready and waiting for all of you to call.
Yeah. Thank you. And like you said, yeah, you can scan the QR code or go to medstarhealth.org/evisit to learn more, to schedule an appointment. And like you said, you can talk with somebody to kind of figure out what your next steps should be. So how does a patient know who they should go first to seek care? Is that, like you said, something you do a virtual appointment and then they can direct you to your next steps, or what would you recommend? How does that work?
Yeah, honestly, if you access any of these ways, you will have somebody to help direct you. Healthcare is complicated. It's not simple, um, but you will have someone to help direct you on this. And so, if you have a primary care clinician, that's a great person to reach out to initially. If you have something that urgently needs to be addressed and it's a Saturday, our eVisit urgent care video visits are a great way to access our health system and get your questions answered. So I would say the short answer to that is reach out any one of these ways and we'll be able to guide you.
Yeah. And my last question for you, you touched on this in the beginning, but I think it's a good way to wrap up. Why is this so important for patients, having all these different points of access to receive care?
Yeah, I would say that healthcare system is hard to navigate. I would say that we all really, really value our primary care clinician. I think those who have established with the primary care just can really see that the relationship is really valued, and they see how their health improves when they have a solid relationship with their primary. But because we can't clone all of our primary cares, we have these teams built around the primary cares so that we make sure we can get you what you need when you need it.
Great. Well, thank you so much. That's all the time we have for today. And thank you to our viewers for tuning in and for Dr. Saggar for answering our questions. If you'd like to learn more about eVisit, you can visit medstarhealth.org/eVisit. To schedule a primary care appointment, visit medstarhealth.org/primary care. And to reserve your spot for urgent care, visit medstarhealth.org/urgent care. We'll be posting all of these links in the comments below as well. So thank you again for joining us and answering our questions, and we'll see you next time.
My pleasure. Thank you.
Thank you.